So ovarian cyst is a cyst which arises from the ovary, and in ultrasound terms, they usually call it as an adnexal cyst. It's a Greek word. What it means is they imagine uterus to the midline structure, and the adnexa, you've got two adnexa on either side, left and right. And the cyst can arise from the ovary, or it can arise from the fallopian tube, and sometimes they can have embryological structures which are like basically men and women develop the same when they're a baby inside the mother's womb, but later on the reproductive organs separate into different parts, and some of the male structures still remain in women. You can get various kind of cysts arising from male remnant in women, embryological remnant in women. So we call it mesonephric cyst. But there are various other cysts women develop during reproductive age. That could be normal eggs which are produced during the different parts of the menstrual cycle, and we call it physiological cyst. And sometimes you can get abnormal cysts which can be cancerous, but the incidence of cancer is very rare in premenopausal women. It's around less than 1%, but most likely to be benign cyst, like you can have dermoid cyst, for instance, where there is embryological remnant inside the cyst, which can contain teeth, hair, and sometimes fat in it. Or you could also have cyst where there is blood content in it. So you could have a bleed inside the cyst, which we call hemorrhagic cyst. Or sometimes there can be menstrual blood collecting on the ovary. That is called an endometriotic cyst. This is a broad perspective. So the main symptoms, most of them are asymptomatic. Women don't have any symptoms, and it's incidentally detected when women present with some vague, non-specific symptom. They do a scan, they pick up the cyst, and but once it grows to a certain size, then women tend to have symptoms like it's depending on the weight. You feel like there's something dragging kind of sensation, or sometimes it can be vague pain, aches when you move, or like women can have pain during sexual intercourse. And occasionally the cyst can get twisted or torted around itself, causing severe pain. We call it ovarian torsion, and that can present as an acute emergency where women present to A&E and then have an ultrasound scan and it's get detected. But the most common one is the endometriotic cyst. Like every month when women have periods, the menstrual blood spills through the fallopian tube into the lining inside the tummy, and some of it grows on the surface of the ovary. And these kind of cysts present with problems with getting pregnant. Women have problems with subfertility, and sometimes they can have severe pain during periods, and sometimes it can get progressively worse over a few years. And also women are present with pain during sexual intercourse, and sometimes it runs in family. So yeah, but there are different kind of cysts which arise in women who go through menopause, and obviously the incidence of cancer after menopause is much more common compared to women in the reproductive age. The incidence goes up 3 times higher once women reach 50 or menopause. And the incidence of cancer in the ovary is around 1 in 70. And these women present with, because they don't have periods, they present with vague, non-specific symptoms, like, they might have new onset urinary symptoms. If the cyst is pressing on the bladder, they wake up in the night, go to the toilet more often, or sometimes they can have accidents when they cough and sneeze. We call it stress urinary incontinence. And sometimes they have present, if it's an advancing cancer or it's a slow growing one, they can have a loss of appetite, where they don't feel like eating. They might have nausea, vomiting. And if there is a lot of fluid inside the tummy, then they have bloating sensation. And occasionally in certain kind of cancers, they lose weight, But paradoxically, if there's lots of fluid which is filled in the tummy or in the chest, they have increase in weight, And obviously, if they have advanced cancer, they develop, blood clot in their lungs or fluid in their chest, and that might present with, women present with A&E with shortness of breath, and during investigation, they get diagnosed to have cancer in the ovary. So the main risk factors for ovarian cysts, the most common one we see is polycystic ovaries. It's mostly related to women with high BMI, where the body mass index is above 30, and invariably they have problems with ovulation, with irregular periods, or problem with getting pregnant, and and those group of women need complex input to as a preventative medicine, and they also need periconceptional advice to stop them from getting lots of health issues in the future. So that's yeah, we'll stop it there. And the next important risk factor is endometriosis. Endometriosis generally tends to run in families, and invariably women start having problems with heavy periods, painful periods, and pain during sexual intercourse, and they seek it might take up to a few years before it gets diagnosed, because they end up seeing various different specialties with vague non-specific symptoms before they have the final diagnosis of endometriosis. And the third most important thing is cancer. Cancer of the ovary generally, in majority of cancer cases, we don't have any strong linking. Only on ultrasound scan, we find there's high index of suspicion, and then they get discussed. They have various blood tests to evaluate for cancer, and then they get discussed in a multidisciplinary team meeting before being offered surgery. And sometimes you end up having precancerous cells on investigation. But the main thing to look for is genetic predisposition. Generally, women who have cancer, have strong family history of breast, ovary, and bowel cancer tend to have cancer arising from the ovary. So ovarian cyst. Okay, the ovarian cysts are diagnosed basically by ultrasound scan. That's the most least invasive and most useful investigation to have, because the fluid contents are better seen on an ultrasound scan. And if women tolerate a transvaginal scan, it's an internal scan. You can look at the uterus, ovaries up close with better resolution of image and good magnification. And depending on what was found on scan, I invariably request further tests. So in women less than 50 in premenopausal age group, the chance of ovarian cancer is low. So it all depends on the family history, genetic predisposition, and the contents which are seen on ultrasound scan. It obviously depends on the size. The larger the cyst, the more the suspicion. Cysts generally less than 7 centimeter are more likely to be benign. But more than that, we also look at septa. Is if the large cyst has got further small cysts in it, then it raises an index of suspicion. And then it also depends on the thickness of the septa, like how thick it is when we look at it on an ultrasound scan. And also, we look at if there's any kind of cauliflower kind of growth inside the cyst, which raises a high index of suspicion. So if there is any doubt or any ambiguity on ultrasound scan, we invariably request an MR scan or CT scan, depending on the ultrasound profile. So the benign cyst, it becomes quite obvious when women have ultrasound scan. The follicular cyst doesn't need any treatment, then you just need scans, follow up if there is any ambiguity or doubt. But the polycystic ovarian syndrome, where there are lots of cysts which are produced, they don't necessarily need removal or treatment, but they need medical input and managing patients' complex individual needs, whether it's subfertility. We'll stop it at that. Yeah. And the dermoid cyst invariably required surgery to have it removed. But if patient's high risk and doesn't want to have an operation, so it can be left alone as long as patients are aware that there's a small risk of torsion. And endometriosis, this needs complex input from endometriosis unit and also multidisciplinary input from reproductive center if the patient has problems with getting pregnant. And if patients completed a family, then, we would recommend, having a surgery to have it removed, because whatever laparoscopy or tests treatment do for endometriosis, it keeps recurring throughout women's reproductive life. And only thing which time when it stops is when women go through menopause. And pelvic inflammatory disease needs detailed investigation and then treatment with antibiotic. And in certain minority of cases, women need an operation to have it drained or, to have it removed if they don't respond to antibiotic. And cancer and precancerous cysts in the ovary, they need a multidisciplinary kind of input. And depending on the size and site of the cyst, a small one can be removed through keyhole operation, but if there is high index of suspicion, it's really important that we don't spill the content of the cyst. It has to be either done keyhole, but the cyst has to be removed in a leak-proof bag to avoid any spillage or spread of any cancer cells. And obviously, if it is a large one, it will be done in a cancer unit with an open operation.